Hello, everyone. Can you hear me? If you can, please write yes in the chat. Yes, okay. Okay, great. Maxim, thank you. Semen, thank you too. Okay, right. So some people are still joining. So let's start just a little bit. My name is Katerina Kafka-Weber. I am very happy to see all of you. And I just want to explain why we decided to start it. So I'm the co-founder of TK Lingua Online English. And now we have about 45 vets at our school. And we wanted to give them some more real life experience. So that's why you are here going to practice English. And remember that it is practice, so please be nice to our speakers. The first speaker is Maria Lapshina, who will talk about, yes, Maria is very energetic today. She will talk about fast ultrasound. Maria is the head of ultrasound at Skolkovo Vet. So Maria, over to you.
Hi, everybody. Now we will start, yes?
Yes.
Okay, 1 minute. Okay. How you hear me? Now, please, in the chat, write. You hear me? Yeah. Okay. It is the first experience of me, and I'm very nervous because my level English is intermediate, maybe some upper intermediate. And thank you, Katerina, for this event, and I hope my lecture will be good for you, and please tell and please tell me, do you use fast ultrasound? Please write on the chat. Do you use this? What is the AFAST? AFAST is abdominal focused assessment with sonography for trauma. It is a very weekly examination because we need to know about what happens in vet. Yes, thank you. And 1 second. And AFAST, it is a focused abdominal sonography for trauma, triage, and monitoring, aimed at detecting the presence of fluid in peritoneal, retroperitoneal spaces. And of course, the results of examination are used to immediately take measures to stabilize the patient's condition. Serial studies can be used to monitor hospitalized patient. In emergency situation, focused ultrasound examination are increasingly used as an adjunct to physical examination. What's the indication and why we will do this examination? It is post-operative patient at risk of bleeding, peritonitis, and effusion after portosystemic shunts, ligation, for example, to control portal hypertension, sorry, anemia collapse, unexplained hypertension, tachycardia, loss of consciousness, any possible types of injuries like trauma, everything of trauma, and of course shock. What the patient preparation and how many preparation we will use when we will do fast. If no samples are taken for ultrasound or other interventions, don't shave, because how I said, it is very quickly examination assessment, and you need quickly set about have patient free fluid or not have. Use is the propyl alcohol and or ultrasound gel, a lot of alcohol and a lot of gel, because if pet have long head, you have problem with making ultrasound. Alcohol should not be used for hypothermia, but in our practice we use because we will make very quickly this assessment. Patients with dyspnea are provided with oxygen and scanned in a supine position of the chest, only this position. What can a FAST do? Well, first of all, identify free fluid in the abdominal cavity, retroperitoneal space, prognosis for anemia, trauma, tumor rupture, post-operative patient, for control free fluid. For example, anaphylaxis, sigh halo of the wall bladder, to detect free fluid in the thoracic cavity, and detection of passive venous congestion. What's the classification of the fluid, the abdominal cavity? We have four scan points. The first scan point is cystocolic. The second scan point is a splenorenal scan, splenorenal points window. The third scan point, the third window, it is diaphragmatic hepatic window, and the last point, it is hepatorenal window, hepatorenal space. It is a typical protocol of FAST when we can use this protocol, and we need to write how patient position, what the organ we assessment, we examination. It says gallbladder. We need to check contour. We need to check a wall. Urinary bladder. We need the same measures. Diaphragmatic or hepatic view. What we can see in this window. We can see pleural fluid if we go cranially or the transducer, and present or absent, mild, moderate, severe. Pericardial fluid, present or absent, mild, moderate, severe, often indeterminate. And of course, hepatic veins. So we need to see, because veins, it's very important to control if we have problem of the heart. Diaphragmatical hepatic site, we have score 0 or 1, and the other sides the same, 0 or 1, and of course we check how many scores we have. 0, it is negative, it is this score explain that all quadrats, when you make examination, there is no fluid. And of course, if we can see is this everything sites, it's oh my god, sorry. We can see all of these sites free fluid, and we can find of 4 of this, and we can write 4 score. Let's check how we can do it. We need to put transducer off the window. Now, for example, near urine bladder, and we move the transducer crook side. And of course, we check these windows. What's the result interpretation? The effusion in the body cavity is often found near the organs and appears anechoic. Cell content, lipid content, of protein content may increase the echogenicity of fluid. But you need to know about that ultrasound can't determine the composition of etiology of the effusion. That you can't know it is urine or it is blood, and only standard synthesis technique, if an effusion is detected, clinical sampling should be performed. Don't forget about orientation of transducer, because it's very important. This is marker, this is orientation, and this is cranially and caudally. In transducer, we have the marker too. This is the marker, and this is the marker. And of course, when we start use and assessment, we put transducer cranially. Marker of the transducer must be directed cranially, and we investigate in longitudinally and transverse projection. Don't forget about this, because you don't understand where are you. For diaphragmatic hepatic window, the sensor is caudal to the hypoid process in the longitudinal protection. This is hypoid, and we can see liver, lobes. We can see gallbladder, and we can see diaphragm, and we can see pleural and thoracic cavity here. And of course, if we have free fluid in pleural, we can see of this window, we can see free fluid here. If we have free fluid in this area, we can see every we can see each lobe of liver. In normal picture, we can see that liver have not different lobes and look like I don't know how in English to say. Kate, can you help me about?
Yeah, sure.
Целый.
Complete whole.
Yeah, complete whole. Sorry. The fuel assessment in the window includes gallbladder assessment and transdiaphragmatic pericardial imaging. How we can see the free fluid in pleural cavity, in thoracic cavity. We can see part of liver. We can see thoracic cavity. We can see lung, and we can see free fluid. This is anechoic fluid, and we can see fibrin. This is fibrin. Fibrinosis, fibrin, don't know. And this is diaphragmatic position. And we can see liver, free fluid, hypoechogenic fluids, and we can see big hepatic veins and free fluids between lobes of liver. What very important to examination? What do you see? What do you see in this picture? Please write in the chat. What is it? How do you think? What is it? No, it is not puppy. It is not embryo. No. Yes. It's free fluid in pericardial. It's a stamponada of heart, and we can't to check it if we use lineage transducer, because we can't to see all organ, all heart, because it's too big for this transducer. And the first and important thing, you need to choose right transducer that you need to check all organs. And now we can see heart, and this is pericardial, and this is the free fluid in pericardial. And here, this is free fluid in thoracic cavity. What is this? What do you see in this video? We can see gallbladder. We can see free fluid in the abdominal cavity. We can see liver, and we can see a big wall of gallbladder. It is halo. Very often cases with this picture with anaphylaxis. It is very typical sites, but we need to differences for this holistic. Okay,
Cystic.
I think holistic. Yeah. Okay. The next space is splenorenal space, splenorenal window. We can see of this window spleen and left kidney. What's the site? We need to put transducer at the intersection of the transverse costal muscles and last rib. Поперечно-реберные мышцы и последнее ребро. And we can see free fluid in the retroperitoneal space. This picture is the spleen with a hematoma. It is hypoechogenic, and we can see hypoechogenic fat near spleen and small triangle of this picture. It is free fluid, small free fluid, about 1 milliliter. What's the mistakes we can do? Please don't be confused with the main vessels, aorta and cold vena cava. Don't be confused with the intestine in the longitudinal projection. How? Because the main vessels in big breed dogs, main vessels, it's too big, and we need to moving our transducer to see all organs. Don't forget it. Urogenital space. The bladder is adjacent to abdominal wall. Hold the transducer longitudinally and the marker cranially to get image in the long axis. We can stand transducer near urinary bladder. We can see urine bladder and colon. And near this, we can see free fluid. For example, this. First of all, when you check this area, you need to check wall of urine bladder, and of course, near what the fluid you will see. How this is fluid: anechoic, hypoechoic, and hyperechoic. Hepatorenal space. We can see in this space right lobes of liver and right kidney. But the space can be difficult to breathe in large dogs. That transducer in the direction of gravity the liquid down to the table. And when we assessment large dogs, please you need to put transducer dorsolateral 11th or 20th intercostal access to visualize the right kidney. And of course, if you will see free fluid on everything this area, you have 4 score. It means that this is a lot of fluid in this abdominal cavity. It is a result. It is protocol and algorithm interpreted. And this protocol of Gregory Alessandro show us how we do and what we will do that we found free fluid or not found. R fast is negative or R fast is positive. You can make a screenshot, and I can I can give you my presentation. It is a very comfortable, very good picture how we will do when we found this blood. And the last picture today, it is the rupture of the spleen. Violation of the integrity of the spleen, we can see, we can't very good see a capsule of the spleen. We can see hyperechogenic fat. We can see small free fluid in the abdominal cavity. And of course, it is not как сказать, полный разрыв.
Complete?
Yes, it is not complete rupture of the spleen because we can see part of parenchyma spleen, this. And of course, this spleen needs to surgery and need operation, and after need check a fast. What's a fast restriction false and negative result when you can't see free fluid? And when you have mistakes. Why? What's the reasons? And first of all, small amount fluid, early completion of the examination, a sharp change in the position when pet very activity, and heterogeneity of effusion, fluid clots simulate soft tissue, pure acoustic window because pet very fat or not very comfortable goes up to ribs, pure access, wool animal disturbance, resuscitation, equipment outdated, settings malfunction. It's very main reasons if you don't see anything problems in a pet. And of course, operator experience. It's very most important that you have mistake or not have. Okay, that's all. Oh my God.
Maria, thank you very much. I know that it was hard for you, but I think you did just perfectly well. Thank you. Unfortunately, we don't have time for questions.
Yeah.
So, if you have any questions about fast ultrasound, you can message Maria directly, and I think she will be happy to answer them.
Maybe anybody, you understand what I say?
Yes, they do.
Okay, thank you very much.
Okay, thank you, Maria. So our next speaker is Sofia Pyatnitsa. She will talk about traumatic intestinal perforation. Sofia is also an ultrasound specialist, but at Clinic Best in Novosibirsk. So you can start.
Hi, everyone. I want to tell you today about one particular case about traumatic gastrointestinal perforation. Don't worry, I will be I will do it quickly. And how often does it happen? How often does it happen? Actually, it's not so common situation in our practice. It happens rarely, and we shouldn't be suspicious about traumatic gastrointestinal perforation every time when we have a patient with trauma. and people say that when you hear the sound of hooves, think horses, not zebras. So we should know about it, but we shouldn't be suspicious about it every time. So why it's so rare? Why it's so rare condition? First of all, because of central location of the gastrointestinal tract, and of course because of extreme mobility. So it's not every time when we have a trauma we see this really rare condition. But anyway, in general, which cases can lead to this traumatic gastrointestinal perforation? In general, we have two types of trauma. There is a blunt trauma and penetrating trauma. The most common situation in our daily practice about blunt trauma, it's a high-rise syndrome. Especially it's typical for cats, especially when the weather is getting warm. At the summer, we have a lot of cats which are falling from the windows. Car accident, of course, and unfortunately, sometimes we have this blunt trauma from human abuse. It's not very often because the kicker should be really strong to make this trauma which can lead to intestinal perforation. But anyway, and about penetrating trauma, of course, bites by another dogs, gunshots, and step wounds and impalement injuries, which can be even self-induced. It's typical for greyhounds, for example, which can run madly and they can bump into the fences, into the stick, and that's how they get such types of trauma. And unfortunately, we sometimes we can have these zebras, like this dramatic case of overdoing when someone ruptured the stomach of the old lady doing a Heimlich maneuver. It's not a common situation for us, for our patients, but anyway, remember about it. About this zebra. About our daily practice, high-rise syndrome, having cats, it's really typical for us, and this cat can come to us with some emergent conditions like shock, facial fractures. They can have hard pellet fracture, thoracic trauma, orthopedic trauma. Often they have urinary bladder ruptures and urinary bladder injuries. Sometimes we can face with pancreatic injuries and even pancreatic ruptures. And of course, it's very often when we see a hemiabdomen in patients with trauma, with blunt trauma. Why it's so important to differentiate to these conditions? Just hemiabdomen and hemiabdomen with septic peritonitis. Mostly because not every patient with hemiabdomen needs to go to the surgery department. Not every cat with splenic rupture or splenic injuries or liver injuries require this immediate surgical intervention, because sometimes we just need to wait and we need to do blood transfusion, and that's all. But if we face with septic peritonitis, these patients need to go to the surgery department because of high risk of septic complications. So how can we differentiate these two conditions by ultrasound? Of course, we can or we can analyze this fluid, and we should find any inflammatory cells there. But now we talk only about ultrasound. So how to differentiate to these conditions, hemabdomen and septic peritonitis? Of course, free gas, it's very specific finding for perforation. If we are sure that we don't have any penetration, and we are sure that we don't have, that our lungs and diaphragm are intact, we know that there is no way to get this free gas into the abdomen other than from intestines. So if we have it, we know that we should find alteration or rupture and so on. And the set news that only 30–50% cats and dogs with intestinal perforation demonstrate this free gas by ultrasound. So if we don't see it, it doesn't mean that there is no perforation here. And how we can see this gas by ultrasound, how on ultrasound picture video, we can see here the intestinal loop. We can see the gas inside the intestinal loop, and it's okay. It's not. It's how it should be. But here we can see this artifact underneath our probe. Under the abdominal wall, we can see this A lines. This one, if you see my mark, okay. This A lines, and it means that we have a free gas outside the intestinal lumen, and it's not okay for us if we don't have penetrating trauma. Another interesting finding, it's a intestinal wall corrugation. Corrugated intestinal wall. Here you can see this pattern, and it's uncommon. It's unexpected to see this when we have only hemabdomen, because it's an inflammatory sign, and we should think about septic process and about ischemia here when we see this intestinal wall corrugation. This finding we should be careful with it. And if we are lucky, we can see this sign. We can see hyperechoic mass outside the lumen with a mild shadowing. And what can it be? What can it be? We know here. We know it in retrospect. That it's a stomach content. It is stomach content after the falling, and it's a stomach rupture, and it's a maybe pedigree or purina, something like this here. But it also can be a large bowel content, like it can be feces. So it's not okay to see this picture, to see something with mild or severe shadowing outside the lumen. We can see the loops here and this mass outside the lumen. And again, and we know that it's not just the hemabdomen. Even if we have a lot of bloody fluid here, we know that there is something else, and we need to do laparotomy here, and that's why it's important to know about it. And be aware of delayed complications, complications which were described here in this publication, delayed intestinal perforation secondary to blunt force abdominal trauma in a cat, which were developed after some days after getting a trauma, and you should check every day. You should check it up every day, and I think that's all what I wanted to say. And if you have any question, feel free to ask me. It seems that's I'm done.
Okay, Sofia, thank you very much. Your English was just awesome. So yeah, if anyone has a question, please first write in the chat so you don't all speak at the same time. And then I will ask you to speak so you can also practice speaking. You can just write a plus in the chat if you want to ask something. No, Sofia, I think your presentation was so clear that everybody understood everything. Okay, so then our next speaker, finally, is SemenPerfilov, who will talk about the sedation of cats and dogs at veterinary clinics. Semen is an anesthesiologist at Belyi Klyk and also is the head of the School of Assistants. So feel free to start.
Thank you. So today we will talk about sedation of cats and dogs at veterinary clinic. Veterinary clinic is a really stressful place for our patients. So I think that they need sedation and need right sedation. So to begin with, what do we use sedation for? To reduce stress levels in our patients. A lot of patients which had negative effects at their negative experience at earlier visit of veterinary clinic don't want to go there anymore, and each visit to the veterinary clinic is a kind of torture for them. Moreover, for cats which lives for cats which live in a flat with their owner and without any other animals, visiting veterinary clinic where other animals, for example dogs, are barking, is a real disaster for them. Dogs get stressed also without their owners and barking or howl all the time. Also, we use sedation for safe nervous system of the vet staff. Doctors, vet assistants, and other vet staff became really nervous and angry because of loud sounds which animals can unstoppably make, and and it came to uncomfortable walk. Uncomfortable walk can cause the mistakes, and the value of mistakes in our walk is too high. And also save nervous system of the pet owners. Pet owners hear barking and howl in the hospital, and they don't understand why animals are crying. They think that vet staff bullying them or beating them, but they are just a little bit nervous. So let's speak about the negative effects of the stress. As we know, when we stressed, in our organism, epinephrine and cortisol concentration increases. And if epinephrine has not a lot of negative effects and ruins fastly, cortisol stay for a long term and stay with us more prolonged and has more severe effects than epinephrine, especially when we talk about the long-term stress. So what illnesses can cause symptoms which cause the stress? Elevated blood pressure, diabetes mellitus, reduced function of reproductive system, especially when we talk about the chronic stress, decreases wound healing, and sometimes it's very important for animals which are situated in the hospitals for a long-term period, and when they are after the operations, for example, and treating after the operation. Decreased immunity and may cause different illnesses, such as gastritis. As we know, when we are stressed for a long time, sometimes our stomach, we have stomach ache, and sometimes it increases because of the long-term stress. And when we talk about the cats, we can remember about idiopathic cystitis of cats. So let's talk about how can we let's talk how can we reduce stress. We have different methodics using sedative drugs and alternative methods without drugs, when we can use pheromones, playing with our patients, and etc. The first drug, which is widely used in Russian Federation, is gabapentin. Gabapentin is a drug which uses to treat epileptic patients, but chronic or neuropathic pain, and in high doses, it can cause a really good sedative effect. When we talk about the doses, we can use from 10 to 30 milligrams per kilogram, and in some cases, in some books, we can also find the doses for cats, 150 milligrams per cat. It causes middle sedative and low anxiolytic effect. And when we talk about the stress, we also need to remember about the anxiolytic effect, because when you're stressed, for example, when you watch something fearful and you're calm, when somebody watching you, and inside yourself, you can be very terrified of something, and it is not good for us. We have learned that stress have a lot of negative effects. And gabapentin is not so good to prevent stress at our patients because they look very calm down, but it's because of for example, when you are very drunk, so you have dizziness. So your head round and round, and everything you want to do is stop, lay on the ground, and don't move at all. So the effect of gabapentin is similar. Our patients have rounding area around them, and everything they want to is to stop moving and sleep. So gabapentin is not so good. So good drug to prevent stress, and not so good for sedation. Another one drug which about what I would like to talk is trazodone. Trazodone is antidepressant which can use both in cats and dogs, has a middle sedative and medium anxiolytic effect. So patients, especially in my opinion, dogs, became not so stressed when you put the drug into their mouths, and when they only came to the clinic. But you should not forget about the effect of trazodone with another drugs, and it is forbidden use trazodone with selective serotonin reuptake inhibitor drugs, for example, fluoxetine, tramadol, and metoclopramide, because it increases risk of serotonin syndrome. It is a very dangerous thing, and often we can watch the death of the patient if we use high doses of trazodone, and for example with tramadol or fluoxetine. Another one drug which is so good, as good as trazodone, is fluoxetine. You can use different doses in cats and dogs because cats has a really high sedative effect, so the doses should be reduced. And it has also a medium anxiolytic effect, so to prevent stress at clinic, you should use trazodone or, for example, fluoxetine, one of them. Don't forget about serotonin syndrome, and don't use this medicine with selective serotonin reuptake inhibitor drugs, for example, trazodone. It is a mistake in my presentation. I'm sorry. Forbidden use fluoxetine with selective serotonin reuptake inhibitor drugs, tramadol and MAO inhibitors. It increases risk of serotonin syndrome. Another one, drug, which is, I think, it's good enough, but not everyone think about this drug when we talk about the sedation. It's hydroxyzine. Doses are different between dogs and cats, and it is a tranquilizator, which has a medium sedative and medium anxiolytic effect, and also which is, this drug can cause antiemetic and anti-allergenic effect, which will be very useful to use this drug in preoperative time. As you know, a lot of our patients before after premedication has vomit, and antiemetic effect is good enough in this case. And also this drug uses by dermatologists with allergenic, I can't remember the meaning of the word. Katerina, zud.
Itching.
Itching, yeah. And one of the metabolic after the metabolic hydroxyzine, we have metabolite cetirizine, which has anti-allergenic effects. So dermatologists can use it in their practice, and some dermatologists often use this drug to calm down their patients. And dexmedetomidine, it is very often used medicine. Doses are not so high to have a sedative effect and medium anxiolytic effect when our patient is treating at hospital, and you can use it to splash it in the mouth, or you can use it to intramuscular or even intranasally. Not recommended for cats and dogs with hypertension, because some of the effect of dexmedetomidine can cause hypertension, severe cardiac dysfunction, and patients with abnormal heart rate. And also dexmedetomidine can cause vomiting effect. So, for example, patients which vomiting is prohibited, so you don't use it with high eye inter-eye pressure, I think, with high brain pressure, for example, and etc. And you also can combine different drugs to to have more severe sedative and more severe anxiolytic effects. For example, when I have a patient which is very nervous before the operation, and when it came to the hospital, I can use dexmedetomidine. For example, 3 micrograms per kilogram intranasally, or just splash it in the mouth. And also use fluoxetine or trazodone for dogs, or sometimes I use gabapentin in cats. It's my own experience, and cats with gabapentin has a rather good sedation with dexmedetomidine. Also, dogs have a good sedation when you use dexmedetomidine and, for example, fluoxetine or trazodone. And the beginning of the action of pills, for example, gabapentin, trazodone, or fluoxetine, acts about 40 or 60 minutes, the beginning of the action. And dexmedetomidine, when you splash it in the mouth, you can watch an effect after 10 or 20 minutes. So the patient is not so stressed. Okay, and the last one, drug which is widely used in Russian Federation, but it's not so good. It's azithromycin. Doses are has a big variety from 0.1 to 3 milligrams per kilogram, but I don't recommend you use these high doses from 1 to 3 milligrams per kilogram, because the negative effects are very high, and so the risk of negative effects are very high. So azithromycin has a medium sedative and no anxiolytic effect. So the patient will sleep, but it can bite you, for example, and this is not good both for patient and for the vet staff. Not recommended for cats and dogs with hypertension and severe cardiac dysfunction. And the main minus of azithromycin is a long-term, unpredictable duration for about 6, maybe 8, 12, even 24 hours. And if the animal has renal or hepatic diseases, it can cause a long-term duration about 48 hours, and not recommended if you have alternative sedative drugs. So when we talk about the alternative methods, we can speak about separation of dog and cat area, and it should be separated, not only separated, but also you should have different ventilation for cats and dogs, because when cats which live at home alone with the owners, they can be very scared when they smell dogs, especially dogs which are living in the open area outside the house. And also the areas which dogs and cats live should be at hospital, I mean, should be not cats shouldn't hear barking dogs because it can be scared them too. Using pheromones, but it's not sometimes very useful, because for using these pheromones, the area which where you will be use them should be not has not so good ventilation, because if it has a good ventilation, pheromones will go out from this area and don't act at all. And also you can use toys for example Kongs, where you can put some delicious food and puppies and dogs and other dogs can try to try to take this food out, and they don't bark at all and don't woo. So that's all. Thank you for your attention, and me and my colleagues now they are making a project, Vet Navigator, which is which will be in the internet for about after 2 or 3 months, I think. Where it is a resource of for pet owners, when they can learn more about the sedation of cat and dog friendly clinics, and how they should act when they are in clinic. Thank you.
Semen, thank you very much. I am excited myself about Vet Navigator. I know a lot about it and I'm waiting. I think, your job is the right for you. You are so calm, and I felt calm. Thank you. Okay, does anyone have any questions? If you have, then please write in the chat, or you can always ask Semen later. No, I think everything was very clear. Semen, thank you again. And
thank you very much.
We can finish now. Thanks everyone for coming. I hope it was useful for you and you enjoyed the conference. So if you feel that you need to improve your English, you can message me, and have a very nice day. Thank you and goodbye.
Thank you. Bye.